Linda's always been super nice, she's super funny, and she's always super interested in me.
Linda Warner has always been a champion for social advocacy in the community and abroad. Her calling was in nursing, and the moment she started nursing at UBC, Linda says she knew that she had found her place.
My first job was working with babies of mothers that are addicted to narcotics. From there, I went to Japan for a brief opportunity as a school nurse and educator. Since then, I basically returned back to Children's Hospital, worked in a variety of units, and have since moved into research, starting with vaccines, and in the last 11 years with the child cohort study.
The child study is a cross-Canada study looking at the growth and development of children and their immune systems. Asthma and allergies are a primary focus, but there are lots of other aspects of childhood health that they're beginning to look at as a result of some of the results they've seen.
Linda's the heart and soul of child study, and really probably her greatest contribution has been to engage with the children and their families as true partners in research. She helped develop child studies participant engagement strategy. She then designed and implemented surveys, feedback surveys, where the children and the families told us what was good, what wasn't so good, and what we could do better. And then this ultimately culminated in Linda forming a participant engagement committee that helps us actually shape what the child study does. So this true commitment to having the patients as our partners is Linda's legacy to the child study.
I think she should be a healthcare hero because she really believes that we can make a better future for other children and other families too.
She takes the time and she has the interest and she motivates everybody else to be just as enthusiastic. And Luna was saying this was like the best day of my life, and it was a blood test. And she was like, they took a blood test. And I'm like, yeah, but it was so exciting.
A humanitarian at heart, Linda believes in effective healthcare for everyone, everywhere, and has volunteered with charities in many marginalized communities that have been devastated by destruction and poverty, including the Dominican Republic, Mexico, Haiti, and Tanzania. Her achievements have not gone unnoticed. News outlets such as the Vancouver Sun and the North Shore News have featured articles on Linda's volunteerism and her dedication to community building. One of her crowning achievements is volunteering as a pediatric nurse in Haiti with Rose Charities, a Canadian charity helping people overcome poverty through education, community support, and healthcare.
I think one of the favorite moments I have in my nursing career was not in Canada. It was probably in Haiti. And the reason it was a favorite moment for me was because it gave me gratitude for the healthcare system that we have in Canada. It also helped me realize I could make a difference, but I had a baby that I was looking after that had been dropped on the steps of this hospital in a very poor community. And the children in this ward were nothing like here. They had disease that are curable in Canada, so vaccine preventable or able to be treated through surgery. And I had a baby in my arms that died. And I held her and I was singing to her. I recognized that I could make a difference even in this small child's world until she died by singing to her. I could feel her snuggling into me. But it also gave me gratitude and hope for when I came home that I could be part of a bigger system that would help improve healthcare and also lives of children, which has always been my biggest area that I'm passionate about.
For being a passionate healthcare champion with an unfailing loyalty and commitment to social advocacy for those in need, as well as inspiring others to follow suit, Linda Warner, you are this year's healthcare hero. Generously sponsored by Pacific Blue Cross.